Caitlin Tydings from Children's National Hospital, and today I'll be talking about the immune effects of HIFU ablation and checkpoint inhibitors in mirroring neuroblastoma. Neuroblastoma is a neoplasm of the sympathetic nervous system. It is the most common extracranial solid tumor in pediatrics, and unfortunately, the majority of patients have high-risk disease at the time of diagnosis. And this is important because high-risk treatment requires a multimodal approach, and despite these intensive therapies, the high-risk population has a 5-year survival of only about 40%. Neuroblastoma is thought to be a cold or non-immunogenic tumor due to the immunosuppressive tumor microenvironment. And checkpoint inhibitors have revolutionized cancer therapy, but pediatric solid tumors haven't shared in this success. Generally speaking, the immune system is able to tell normal from foreign cells. Checkpoints are molecules on immune cells that need to be activated or inactivated to start an immune response. And malignant cells can cause desensitization of immune cells and avoid being killed. Checkpoint inhibitors turn off the immune cell blockade and allow the immune system to kill cancer cells. We'll be focusing on anti-PD-L1 on tumor cells and anti-CTLA-4 on T cells. We'll use this in combination with high-intensity focused ultrasound, which uses an ultrasound transducer to focus acoustic energy in a target area within the tumor. It can have both thermal and mechanical bioeffects. So we'll be focusing on thermal, specifically ablation when temperatures exceed 55 degrees Celsius, causing cell death by coagulative necrosis. This is important for us because HIFU has been shown to increase the immune response to tumors locally and potentially distally by causing local inflammation that stimulates the recruitment of effector cells. So we seek to harness this pro-inflammatory response of HIFU to potentiate the effect of checkpoint inhibitors. And this is based on prior work performed and being presented by Dr. Avinash Aranki in the combination of histotripsy with checkpoint inhibitors, which found that it could prolong survival and produce a robust anti-tumor effect. Given we have a clinical MR HIFU ablation system at our institution, we sought to determine if thermal ablation in combination with checkpoint inhibitors could prolong survival and induce a systemic immune activation like histotripsy did. Similar to the histotripsy study, we were able to thermally ablate less than 5% of the tumor tissue that led to necrosis of about 1/3 of the tumor. Our general schema was injecting tumor cells, waiting for goal growth, treating with HIFU thermal ablation either by itself or in combination with checkpoint inhibitors, and we first monitored for survival. In striking contrast to the histotripsy study, there was no survival benefit of either HIFU ablation alone or in combination with checkpoint inhibitors. We also evaluated cellular and cytokine expression by drawing blood, removing lymph nodes, spleen, and tumor at 3 different time points following completion of both experimental groups. A few key points. There were no change in expression of cytotoxic T cells following either therapy, which is in contrast to the histotripsy group, which showed a significant increase in these cells. Interestingly, there was an upregulation of PD-1 expression on cytotoxic T cells. PD-1 expression is thought to be related to T cell exhaustion. There was an increase in regulatory T cells in all samples. Again, this is in contrast to histotripsy, where there was a significant decrease in regulatory T cells. And there were little to no CD8 positive dendritic cells, which again is in contrast to histotripsy, where there was a significant increase in these cells. With regard to cytokines, there was no significant pro-inflammatory response following HIFU ablation alone. And following combination therapy, interferon gamma increased, which is a little bit concerning because interferon gamma can drive PD-L1 expression, and this was shown to increase even after our last dose of anti-PD-L1. So in conclusion, HIFU alone and in combination with checkpoint inhibitors did not prolong survival. HIFU alone did not show a significant immune response, and there was a significant contrast between HIFU ablation with checkpoint inhibitors and histotripsy with checkpoint inhibitors, in that the effect of HIFU ablation actually seems to promote immune tolerance as opposed to the anti-tumor response that we saw with histotripsy. It'll be important to understand the role of PD-1 and pro-tumoral effects and replicate this study in different cell lines, which we're actively doing now in rhabdomyosarcoma. I'd like to thank my team, particularly Dr. Avinash Aranki, who was vital to this project. Thank you.